Oh, hi there. My name is Elizabeth, and I am a labor and delivery nurse, certified childbirth educator, and creator here on YouTube. But I am so much more than that. Today, I am coming to you with a really specific cause that's really close to my heart and my butt. Like many of you, I suffered from FOPO, fear of pushing out postpartum poop. But I'm here today to let you know that there is a cure for this fear. There are steps that we can take towards making sure that your first bowel movement after delivering your beautiful baby doesn't feel like delivering another less beautiful baby. Okay, friends, I know that intro was a little silly, but I'm in a silly, goofy mood, and I know that a lot of us super stress out about having that first bowel movement after baby, and for good reason, right? Whether you've delivered vaginally or by a cesarean birth, your pelvic floor has gone through a lot. You potentially have stitches, you potentially have hemorrhoids, you have a lot going on. But I want to give you guys the tips and tools that you need to make that first bowel movement postpartum, and really those first few bowel movements postpartum, slip out like a dream. Before we talk about how you can make that poop magical and fabulous as pooping can be, let's talk a little bit about why that first postpartum poop is a little bit of a doozy. Simply put, we've got a lot of things going on that put us at a greater risk for constipation after we have a baby. We actually don't expect you to poop in the hospital, more than likely. There are definitely people who poop in that first 1 or 2 days after birth, and if you are one of them, rock star, you're awesome. But if you're not, you're also a rock star and you're quite normal. Typically day 3, day 4 is when we see that first bowel movement and that first urge to have a bowel movement come up. And why is this? There's a couple of reasons. One, we know that early labor, we have a lot of prostaglandins flowing that are helping to soften and open our cervix and kind of enhance that oxytocin. Prostaglandins also create some motility in our lower GI tract and lead us to having some looser stools, kind of clearing ourselves out before delivery. We also, because of the heightened hormones and everything going on, all of the blood flow going to the uterus during our delivery, our gastric emptying slows. So while I do encourage you to eat and drink during labor, a lot of times as labor gets more active, you are not feeling like you want to eat or drink. You might even be throwing up if you do try and eat because that gastric emptying has slowed. Couple all of that with the fact that when you do have a vaginal birth, more than likely you are going to poop what little amount of poop is in your rectum out when you're pushing to give birth to your baby, because pooping is normal and it tells us that you're pushing in the right spot and nothing to be embarrassed about. And even if you don't poop, you feel like you're pooping. Now, if you have a cesarean birth, some reasons why we might see a little bit in delay in pooping is, again, that delayed in gastric emptying. So anytime we have a surgery, our GI tract can slow down. There might be some nausea and some vomiting associated with your surgery or after your surgery due to the pain medications that you have on board and changes in your blood pressure. Another thing that we see with cesarean births is that you're more likely to take narcotics for pain management, and narcotics are a great tool that we can use short-term to manage post-op surgical pain or any significant pain if you have significant tearing or significant cramping after a vaginal birth as well. But their biggest complication that is going to be an issue for us in that immediate postpartum period is that they cause constipation. So you want to stop taking narcotics as quickly as you are able to manage pain with other pain management tools like ibuprofen, ice, Tylenol, an abdominal binder after a cesarean birth, because they do cause constipation. And when we have constipation, that means that our stool is going to be drier and we're going to have to be straining to get it out. And we really want to avoid that because that extra strain puts extra pressure on our pelvic floor and on any fresh surgical abdominal incision that you might have. Why do we find that first bowel movement to be so uncomfortable? It has to do with a whole host of things. We've talked about that pelvic floor that has gone through strain. A baby has passed through your pelvic floor. Baby has also passed through your vaginal canal and perhaps caused some tearing in that perineal area, so that area between the bottom of your vagina and your anus. Often we see a first or second degree tear, which just involves the skin and the muscle, but you might have a more significant tear that involves the anal sphincter. Those would be those third and fourth degree tears. And that trauma in that area is going to make that area quite sore. Often too with pushing, if you've had hemorrhoids previously or during your pregnancy, those hemorrhoids can come out to play and you might be experiencing some straight up roid rage going on, which is going to make having a bowel movement uncomfortable as well. And then again, if we've had a surgical incision with a cesarean birth, those ab muscles were cut through, that whole area can be very, very sore. And a lot of times those are the muscles that we're using to have a bowel movement. So all of those things make things sore, coupled with the fact that we might experience some constipation. So we're having to push and strain more than we would typically. Just being pregnant, taking iron pills, all set you up for constipation. So you might have had that constipation kind of brewing during pregnancy, carries over into postpartum. So what are things that we can do in that immediate postpartum period to make your first bowel movement not be shitty? So the first thing that I want you to focus on in the hospital is taking a stool softener. Docusate is the one that we typically give. Often it's ordered PRN twice a day. PRN means as needed. Now I always hand mine out to my patients in the morning and in the evening to make sure that that first bowel movement is nice and soft and ready to go. But if nobody's giving you a stool softener, ask for it, because PRN, because it means as needed, sometimes it means that you have to request it. So you can request it in the morning and in the evening. I would buy one to have on hand for postpartum as well. The other thing that you can be doing is making sure that you're drinking lots and lots and lots and lots of fluid. The other thing you can do is eat a high fiber diet. Fiber helps us pass our stools more easily and reduces constipation. The other thing that you can do in the hospital, if you're feeling like you need to go but you can't, or at home, is do something called an OB cocktail. So what you're gonna do is 2 parts prune juice, 1 part orange juice, 1 part apple juice, and you're gonna mix those together and then you're gonna warm them up in the microwave. It's best if you drink it hot. Hot liquids, I feel like, tend to help us have a bowel movement. It's gonna taste like a hot apple cider. Straight prune juice has a thickness to it that makes it nasty. When you cut it with the apple and orange juice, the flavor's immaculate, chef's kiss. If you get to the point where you feel like you cannot go, but you need to go, you're feeling that urge coming where you need to have a bowel movement, that's when you can start adding in Miralax or another laxative perhaps. I would talk with your OB and see what they suggest that is best for you. Typically in your discharge instructions from the hospital, it will have those listed out, but that's not something that you want to start with. You just want to start with the fiber, the hydration, the prune juice, getting things moving. Now, when it's actually time to have a bowel movement, this is how you're going to know. You're gonna feel the urge to have a bowel movement. You're gonna wait until that urge is very strong and that stool is right there. We do not want you straining, putting additional strain on that pelvic floor, putting additional strain on any sutures or stitches that you have going on, whether that's in your abdomen or in your perineal area, okay? And then you are gonna gather your tools to prepare yourself, okay? If you have had an abdominal birth, I want you to have a pillow on hand so that you can brace your incision with that pillow. Regardless of your birth type, I want you to have a squatty potty or alternative, a stool on hand that you can put for your feet to go up on. I want you to have really nice, soft toilet paper. I want you to splurge on that fancy, quilted, northern, plush, pillow-like toilet paper. I would love if you have some wet wipes and your squirt bottle on hand as well, so that we are just really, we're doing it and then we're getting nice and clean feeling without putting too much abrasive rubbing on that very sensitive area. I'm going to back the camera up, give us a little bit more room to work, and I'm going to show you how you can use your breath to support pooping, how you can use your position to support pooping, and how you can actually externally support your perineum or any areas that feel sore while pooping. So I'll be right back. A position that is good for pooping, just like it's good for labor, is kind of squatting, having your feet up, and then even knees together, feet apart, right, to open that outlet of our pelvis can help a little bit. Now when you're pooping, a lot of times you might kind of use a Valsalva Maneuver typically, where you hold your breath and you bear down as hard as you can. I don't want you to do that because I want you to really support your pelvic floor that's been through a lot of strain already. So what you can do is take a nice deep breath in and bear down while letting out your breath in that kind of J breath that we do when we're pushing. So taking that air and that diaphragm and directing it down towards your rectum. And you're still bearing down, but you're letting your air out so that you're not doing too much force in that really sensitive area. You want to breathe out almost like you're blowing out a candle is how you're releasing your air. and you're just slowly bringing that poo down. If you're feeling like you're needing a little bit of extra support, this is when you can take some toilet paper and wrap it around your hand for a vaginal birth and place this right in your perineal area and give some extra support to the stitches that way. You might notice, just like when you're in labor, there might be some rocking or some movement that kind of helps bring that stool down. You do you. Give yourself time. Have somebody else take the baby and make sure that you have some kind of like privacy to just have your first bowel movement and give birth to the last thing that you need to give birth to with this pregnancy. Afterwards, you still want to be really, really gentle on this area that has had some form of trauma to it from birth, and you want to use your squirt bottle. If you have a bidet on your toilet, that's great. Use your wipes, use your really fancy nice toilet paper, and just clean up that area. So if you don't have a squatty potty, a stool will work, or even just anything that gets your knees above your bum. So you could put 2 rolls of toilet paper and put your feet up there. This is just helps us get into a really good position to physiologically empty our bowels like we would do if we were out in the woods. We just go squat somewhere. Now, one thing that you might notice when you are having your first bowel movement is you have a little teeny uptick in your bleeding. That is totally normal just because you're exerting that pressure and that force. So don't let that stress you out if that does happen. But if you're filling up more than a pad an hour, or if you're passing clots the size of a golf ball or larger, you definitely want to let your provider know. Hey guys, I hope that video was so helpful for you. If you have not had a baby before, getting ready to have that first bowel movement postpartum, I definitely recommend all the tips that I suggested, like the breathing, the not overstraining, the squatty potty, to use during your pregnancy as well. Constipated, it's also a great way to practice open glottis pushing. Pro tip. And if you have had a baby and you have had your first postpartum bowel movement, if you have any other tips, please share them in the comments. And until next time, bye guys.